Hello, everyone. Many thanks to you for joining me today on Head Plus, the NTA. My name is Nsan Yakubu. Today on Head Plus, common eye infections in children, causes, symptoms, diagnosis, and treatment. Now, your child's vision is essential to his success in school. When his vision suffers, chances are his schoolwork suffers as well. Today, HealthPlus avails us the opportunity to go to the details on common eye infections, extract, and see what can be done about it. It's time to meet the doctor.
In our environment, we see problems such as refractive error, which is that problem where the child is not able to see the board from where he's sitting in class, or he has difficulties in reading. We also have what we call trauma to the eyes, where children, while they are playing, especially during unsupervised play or in school, they now injure themselves with objects, which could be sharp, which could be blunt. We also have conjunctivitis, which is known as inflammation of the conjunctiva. And in that place, you find out that the eye will be red, sticky, and then you find such things can be transferred between children. Another problem that can occur in children is cataract, where there's whiteness of the pupil, that central part of the eye that light passes through to get into the eye. So there's whiteness, it's called opacity of the lens or cataract. It can occur in children. Another thing that can take place is glaucoma, where the pressure in the eye is high, and then you find out that the child will present with a lot of problems and it can interfere with vision. Another thing that can occur is strabismus, what is also known as squint, or what we say in the layman term half past 4 eye, where the eye is turned inward, outward, upward, or downwards. That is a problem that occurs. And another thing that we are also seeing in our practice in the clinic right now is what we call retinoblastoma, which is known as cancer of the eye, and it occurs in children. So these are the problems that we see in our environment. Under the conjunctivitis, there is one that is common, which is known as allergic conjunctivitis. And this allergic conjunctivitis, the child comes with itching. And the itching usually comes during the period where, like during this raining period now, where you find the pollens in the air, the child itches, and then the child comes with all kinds of problems. So these are problems that can occur in children. Now, for refractive error, which we said that the child cannot see the board or has difficulty reading or has eye aches when he's trying to read or see far, we find out that in refractive error, it doesn't really have a cause. It's just that there are people in the population in the environment that have what we call short-sightedness, that is myopia. There are some people that have hypermetropia, also known as long-sightedness. And then there are some people also that have astigmatism, where they cannot focus well. Okay, so this one just occurs in the population, so you cannot really say it has a cause. But something like trauma is when children play, and they play with sharp objects like pencil, pen, nail. Some will even play with stone, catapult, and all these things. When they are playing, they can hit their eyes and cause trauma to their eyes. Apart from stone, they can actually use broomstick, because we have actually seen children that come in with broomstick injury to the eye, and then you find out that it can lead to reduction in vision in the eye, or total loss of vision in that eye. Then for the conjunctivitis, we have what we call, like I said, we have allergic conjunctivitis, where the child has allergy, and so the child is itching. That one is by inheritance. It's not as if it's something that occurs. Some people in the family, yes, they can have it, and so the child itches. And then for those with bacterial conjunctivitis, it occurs when the child puts finger in the eye, which also can occur, okay, following allergic conjunctivitis. They put finger in the eye, and then the child now starts having a discharge, what we call, the eye will be gumming together. And then we also have what we call viral conjunctivitis, which can occur, so, sometimes in certain seasons, like Apollo, you find Apollo occurring. And then such things, when they come, they go on their own. But when the child now starts rubbing the eye, you now find out that it complicates it, and then it has what we call superimposed bacterial conjunctivitis. Then for cataract has causes, cataract in children. We have what we call the congenital causes. That is the one that for some children, they have a family history, and somebody in the family, either from the father's side or the mother's side, already had cataract before, and then the child can now have cataract. And then it also happens when the mother is exposed to certain things, like if the mother takes drugs during pregnancy. Okay, the mother takes drugs during pregnancy, drugs like steroid. There are some things they call steroid, which can be used. Drugs like thalidomide, drugs like haloperidol, that is antipsychotic drugs. All these things can cause cataract in the child inside the womb. And then if the child has what we call chromosomal abnormality, there are some children that like we call them Down syndrome children. They have like Chinese eyes. Okay, they are predisposed to having cataract. And then when the mother is pregnant, and some mothers, they may be pregnant, they won't know. They now go and they now take X-ray during pregnancy. When the mother is exposed to X-ray, it can cause cataract in the child. Those are the congenital causes. Then the acquired causes, that is things that can cause it, is when there's trauma, either blunt trauma, the child is running, playing, and then hits the table, hits the door. That can cause cataract in that eye. And apart from that, if the child takes some eye drop, there are some eye drops that can be taken that can, like what we call pilocarpine, eye drop for lowering intraocular pressure. That can cause cataract in the child. And then for children with strabismus, children that have squints, half past 4 eyes, these children, what can cause it? It could be as a result of refractive error. Like I said, children can have refractive error. It can be as a result of refractive error. It could be as a result of malignancy, cancer inside the eye could cause it, or it could be as a result of a problem of the muscle or the nerve supplying the eye that is responsible for movement. Now, when those things, when there's a problem with those things, the child can have strabismus. Now, Apollo is known as viral epidemic keratoconjunctivitis. Okay, is a hemorrhagic disorder, just like Lassa and Ebola. Those are the kind of viruses that cause it. It's actually caused by what we call enterovirus 70. Now, Apollo itself, because it's viral, it's self-limiting. That is, without any treatment, it can go. But the problem we have in Apollo is that people start putting things like sugar water, urine, all kinds of, they can even take leaf, squeeze into the eye, and so that complicates the problem, which ordinarily would have gone on its own. So for such people, you now find out that we have to treat them for bacterial conjunctivitis. We have to treat them because of that superimposed bacterial conjunctivitis, and then advise them not to use any other thing except the eye drop that we give to them. When a child has Apollo, the parent should bring the child to see the eye doctor. That is the ophthalmologist. Okay, so that the child will be examined. We make sure that vision is not affected, and then we put the child on drugs. That condition is what we call ophthalmia neonatorum, which is conjunctivitis in the newborn, that is in the first 30 days of life. Now, the commonest thing that causes that is what we call gonorrhea, Neisseria gonorrhea, that organism. And how does the baby get it? The baby gets it while passing through the birth canal of the mother. And this is a mother that already has that gonorrhea. And then by the time the baby passes through the birth canal, the baby now gets this organism into the eye, and it now gets ophthalmia neonatorum. So what we do for such babies, we treat, because that condition can actually damage the eye of that child if left untreated. So what we do, we treat aggressively. That child has to be admitted, definitely has to be admitted, treated with both intravenous and topical, that is eye drops, treated with all those ones, and then once it's cleared, the patient can be discharged. And it's not only the baby that is treated, the mother too has to be treated. In fact, the mother and her partner have to be treated for gonorrhea, so that such a thing does not occur again. And then apart from that, you find out that during the delivery process, if the process is not aseptic enough, that is when we say asepsis, that is as neat and sterile as possible, such a baby can have ophthalmia neonatorum. So such things have to be looked at and ensure that, you have to ensure that there's asepsis during delivery, mother is treated before delivery, and then once the baby comes out, we have what we call 5% povidone iodine that is dropped into the eye as soon as the baby comes out. And so all those things can prevent ophthalmia neonatorium. A child needs to see well to be able to grow well, develop well, interact well with his environment and with his friends. But when the child is not seeing well, you find that such a child tends to stay indoor. You now find that the child is doing more of reading because he's not seeing well around the place. So what he's seeing clearly is what he can do. And then you find that such a child, we have to go close. You find some children, they are watching the television, they have to go close to the television. It's as if they are almost looking into the television for them to be able to see. Some of them, you find out that they carry the book and hold it close to themselves, very close. And that's not supposed to be, because there's a normal reading distance for everybody. Okay? So, and then you now find out that the child wants to see somebody far away. He's squeezing the eye because he's not seeing clearly. In school, you find out that when the child is not seeing well, the child cannot copy from the board. And you find out that the handwriting will not be okay. School performance will be poor. So all those things, when a parent recognizes such things inside in his or her child, that child needs to be seen by a doctor, an eye doctor. That is for refractive error. Now, for a child with cataract, you will see a whiteness. You see, when you look into the eyes, there's supposed to be a center darkness inside that space there, known as the pupil. But in a child that has cataract, that place, instead of being dark, that place will be white. And so, once a parent notices that whiteness, that child needs to see the doctor. Because that whiteness means that light is not entering the eye. And then when you find a child with glaucoma, the eye will be big. There are some children, they are born, the child, they will say the eye is fine because it's big, it's nice. Unfortunately, that child has glaucoma. So when the child has big eye like that, or you look at the eye is always tearing, it's always bringing out water. When you put the child in a place that has light, the child is not able to open the eye well. There's something wrong. So such a child should be assessed by the eye doctor, that is the ophthalmologist. And then we find a child having the eyes turned outward, inward. That's not the normal way the eye should look. The eye should look straight ahead. When a child the eye is turned inward, is turned outwards, or upwards, downwards, that is strabismus. Such a child should be seen by the ophthalmologist. And then for retinoblastoma, you find that such children, the mother or the father will observe that in the night, it's as if the eye is shining like a cat. Cat eye reflex. When you notice that with whiteness of what we call the pupillary area, such a child should be seen by the doctor. Now, when children are brought to the clinic, the first thing we do is to find out the story behind it, what we call history taking. We now find out how what the parent observed, for how long, and then we now examine. Now, depending on what we see, that's what the test we do. Now, definitely for somebody with a refractive error, there's a test that we do for them. We call it refraction. The person does that test and is tested for glasses. And so when the test is done, the glasses is given to the child. And I want to use this opportunity. There is no child that is too young to use glasses, because that is something that parents feel that this child is just starting and is using glasses. The earlier the problem is detected and taken care of, the better for that child. Because if the child is not seeing well, and especially when the problem is not equal in the two eyes, you now find out that after a while, the eye that is poor compared to the other one will start turning outward. Why? Because the brain will ignore it. And so that eye, no matter what you do, you can't really help the child. And then when the child sees image clearly, if he sees those images clearly early in life, he will develop good vision. And which is what we all want for our children. We want them to have good vision. We want them to be able to see the board. We want them to be able to read their books. We want them to be able to do well in school and outside. So whatever it will take for them to be able to do well, we give to the children. Now, that is for refractive error. So like I said, no child is too young to wear glasses. What we are looking for is what? Good vision. And that is what we aim to achieve. Now, for patients that have, or children that have cataracts, the treatment for cataract is surgery. We would have refracted the child, we would have seen whether we can improve the vision. If we cannot improve the vision, we go ahead to treat for cataract. Now, for glaucoma, we check the pressure in the eye and we treat. For strabismus, the same thing. We do a refraction and then we examine the eye very well, what we call ocular examination, to ensure that there is no malignancy, no cancer inside the eye. And then after that, depending on what we have seen to be the cause of the strabismus or the half past 4 eye, we treat. And then for children with retinoblastoma, after we have examined what we have done, an ocular examination, want to find out if it's just one eye that is involved or both eyes that are involved. Depending on what we see, once we know that this is retinoblastoma, this is cancer, we have to treat.
That is it on today's broadcast. Many thanks to you for staying with us on this edition. And until next week, stay healthy. I am Msa Yaku. See you.